What could this budget process mean for hospital funding? I'm Jill Horner. This is Comcast Newsmakers. With me is Roger Baumgarten. He is the Director of Media Relations for the Hospital and Health System Association of Pennsylvania. Thanks for being with us.
Thanks for having me.
Talk to us a little bit about where we stand at this point, but before we get into this new budget process, let's talk about the current budget year we're in. There was actually a recently announced freeze when it came to certain types of funding.
Right. The governor announced a mid-year budget freeze because of the deficit that the state is experiencing, and that included 10% reduction in obstetrics and neonatal, burn care, trauma care, and critical access hospital payments to hospitals around the state.
And what kind of impact does that have on certain types of care across the Commonwealth?
Well, the potential impact is very large. Hospitals depend heavily on Medicaid funding. Unfortunately, that funding does not fully reimburse hospitals for the cost of the care. So for every dollar of care provided, the reimbursement is less than that dollar. So any further cuts just erodes the fiscal health of the hospitals and jeopardizes their ability to keep services open.
How reliant are hospitals on this type of funding as compared to funding from other sources, for example, sources from those who have private insurance?
It varies from hospital to hospital, but Medicaid is a significant portion of what hospitals are paid for the services they provide to Pennsylvanians throughout the state. Medicaid being in Pennsylvania, that's what we call the medical assistance program.
Now, let's talk a little bit about the overall budget, because moving into this budget cycle, we're talking about 38–40% of the budget when we talk about the Department of Public Welfare. Let's focus on this next upcoming budget cycle. Where do we stand moving in to this budget cycle when it comes to overall funding for hospitals? What does your organization want to see happen?
Well, we want to see funding maintained in the 2012-2013 budget. The governor's budget proposal when it comes to hospitals is very complex, and we have people at the association analyzing the budget numbers now to see what the precise impact will be, but we're fairly certain that there will be some aggregate reductions to hospitals.
And what does that mean? Because as we've discussed in the past, there have been reductions in past years because of budget challenges and economic conditions.
Well, it's just another hit that the hospital community is taking. And the beneficiaries of hospital care, the patients, are the ones who stand to be harmed by this if they lose access to care.
On the flip side, are there ways in which hospitals can actually work to reduce costs, to work to offset these reductions in payments?
Hospitals in Pennsylvania are actually among the most efficient in the country. There's a study done several years ago that demonstrated that hospitals in Pennsylvania have really done a very good job of being cost effective in what they do. There's not much more you can cut without having to start making tough decisions about services and programs.
Now, when we talk about the overall finances of the Commonwealth, and in this budget cycle, the state of Pennsylvania is still facing a shortfall as they move into this budget cycle. The governor talked a lot about job creation and working to promote growth in his budget address. Are there ways in which maybe the medical industry or the hospital profession could play an additional role in that?
Oh, well, hospitals play a pivotal role in the state when it comes to jobs. We are among the leading employers in the state. Hospitals account for about 600,000 jobs in Pennsylvania. And through the recession of the past 2 to 3 years, hospitals have been one of the strongest job sectors, both in terms of numbers of positions and in wages.
And we just have a short time left, but moving into this budget cycle, what happens if payments are reduced further when it comes to Medicaid and other forms of payments coming from the state? What do you think will happen in your association's opinion when it comes to overall hospital and the future of hospitals and the future of hospitals in certain areas?
Well, if the final budget, when enacted at the end of the fiscal year, does include cuts, it will mean that hospitals will have very difficult decisions to make about services and staffing and what's available to the public.
Thanks for being with us.
Thank you.
We've been talking with Roger Baumgarten. I'm Jill Horner.